we have another group of drugs, that is 𝐸𝑝odophyllotoxins. So if you take this 𝐸𝑝odophyllotoxins, remember you take this podophyllotoxin. Podophyllotoxin was used for its emetic, cathartic and as well as the anti-helminthic effects. Okay, so if you take this podophyllotoxin, the podophyllotoxin was used for its emetic, cathartic and as well as anti-helminthic effect, right, and as well as the anti-helminthic effect. Now you take this particular cathartic, right? What do you mean by the word cathartic effect? It is nothing but it's a sense of the psychological relief, right? It is a sense of the psychological relief. So remember, podophyllotoxin, it is used for its emetic, cathartic and as well as the anti-helminthic effects. Now if you take the mechanism of action of these drugs, right, if you take the mechanism of action of these drugs, remember these drugs, they act by binding to the tubulin, right? So what does these drugs do? They act by binding to tubulin, alright. Now but its derivatives, right, what are the derivatives? The derivatives include etoposide and as well as teniposide. Okay, so you take the podophyllotoxins, they act by binding to the tubulin, whereas the derivatives of this particular podophyllotoxins, and if you take this particular derivatives they include etoposide, right, etoposide, and we have another drug which is called as teniposide. So if you take this etoposide and as well as teniposide, they act by inhibiting topoisomerase 2, right, they act by inhibiting the topoisomerase 2, and by inhibiting this particular topoisomerase 2, that will result in the DNA damage through the strand breakage, right, resulting in DNA damage, right, resulting in the DNA damage through strand breakage. Now if you take these particular drugs, that is etoposide and as well as teniposide, these drugs, they act at the junction of the late S phase and early G2 phase of the cell cycle, right. So if you take these particular drugs, where do they act? These drugs, they act at the junction, right, at the junction of late S phase and as well as, right, as well as the early G2 phase of cell cycle, right, early G2 phase of the cell cycle. Now you take the adverse effects of these drugs, right, if you take the adverse effects of these drugs, remember these drugs can cause the gastrointestinal distress and myelosuppression, right, these drugs can cause gastrointestinal distress and as well as the myelosuppression. Now you take this particular etoposide, remember this etoposide, it is indicated for testicular tumors, prostatic carcinoma and as well as a oat cell carcinoma, right. So if you take this etoposide, it is indicated for prostate carcinoma, right, it is indicated for testicular carcinoma, it is indicated for the oat cell carcinoma, right, oat cell carcinoma is the tumor of the lung. Now you take this etoposide, remember etoposide therapy, the adverse effect associated with this is etoposide therapy can result in acute non-lymphocytic leukemia, right, the adverse effect is it can result in acute, alright, it can result in acute non-lymphocytic leukemia. Now what is this particular non-lymphocytic leukemia? They include acute monocytic or monomyelocytic leukemia, right, they include acute monocytic or, right, or monomyelocytic leukemia. Now this particular leukemia, remember it develops at a short time interval, that is within 1 to 3 years of etoposide therapy will result in the acute non-lymphocytic leukemia, right. So this leukemia develops within short time interval, right, short time interval. that is within a period of, right, that is within a period of 1 to 3 years, right. Now remember, this leukemia develops at a short time interval after the end of therapy, whereas you take the alkylating agents also will induce the leukemia. So after the end of therapy of this particular etoposide, whereas compared to alkylating agents induced leukemia, right. So remember, not only this etoposide, we have another group of anti-neoplastic drugs, that is alkylating agents, they will also induce leukemia. Now this particular etoposide at high doses, the etoposide, it is very much hepatotoxic, right, it is hepatotoxic. Now let me shortly revise about this particular epipodophyllotoxins. Remember, epipodophyllotoxins, we have a group of drugs which is called as the podophyllotoxins. Podophyllotoxin was used for its emetic, cathartic and as well as the anti-helminthic effects. And if you see the mechanism of action, they act by binding to the tubulin, but its derivatives like etoposide and as well as teniposide, they act by inhibiting the topoisomerase 2, resulting in DNA damage through the strand breakage. And if you see the drugs, these drugs, they act at the junction of the late S and early G2 phase of the cell cycle. And these drugs, remember, can cause gastrointestinal distress and as well as the myelosuppression. And if you take this etoposide, remember, etoposide is indicated for testicular, prostatic and as well as the 𝗠𝐨𝐫𝐞 of the lung. And if you take this etoposide therapy, can result in acute non-lymphocytic leukemia, that is acute monocytic or monomyelocytic leukemia. And remember, this leukemia develops at a short time interval of 1 to 3 years after the end of therapy as compared to the alkylating agents induced leukemia. And the other point is, this etoposide at high doses, it is highly hepatotoxic. So that is about your epipodophyllotoxins.